Welcome to the second part of public health communication. In the first part, we have seen the definitions, functions, and the methods of public health communication. How different communication methods can be employed, like interpersonal communication in the group level, or how communication happens within the individual or in the mass level. Mass level communications has a lot of advantage. With the lowest cost, with a limited time frame, you can reach the mass audience, because mass communication carries a credibility, because the communication always comes from the credible health professionals. There's a lot of values being attached with the messages comes from the health professionals. Or if it's required, the group level or community health workers can reach the different corners of the particular city or village to interact with the audience, interact with the members, to influence the behavior of the group members. But it takes time. The members, community health workers, has to strong enough to convey the message to influence the individual. Once mass communication and group communication messages reach the individual, then they start processing the information from the belief system, from the attitudes and perception, and the belief, attitude and the perception are not a process happening in the vacuum. Multiple factors, external factors also influencing. So that's the whole process of health communication. Now, with that background, we will see components of the health communication, strategies of health communication, barriers of health communication. These three are main components of this presentation. Let us take the first part of this presentation, components of public health communication. There are certain number of factors that needs to be taken care, that needs to be fulfilled, or that factor needs to be considered while planning communication strategies. For example, the level of health conditions and awareness level, the campaign strategy, a community level, community background, and what sort of interventions required, and audience profile, and what sort of risk is being involved in the communication process, and the role of social marketing. The health promotion is one of the component of health communication. According to the World Health Organization, health promotion is the process of empowering people to gain better control over their health. A kind of health promotion is basically to improve the health conditions of the individuals or the collective members of the society. This process goes beyond individual behavior to encompass as a social and environmental interventions. It's not just individuals, it's being played in relation with the society and other social environmental conditions. Health promotions programs strive to enable individuals and communities to reduce the risk of chronic and infectious diseases and other conditions by adopting healthier lifestyles. These programs, community or communication strategies of health programs, frequently addresses the impact of social determinants of health. That social determinants means the family conditions, the educational settings, the cultural background, and the social economic conditions. All this influences somebody's and individual's lifestyle, which the social determinants includes the physical environment, social economic condition, and education also that. The second important point in the health communication components is awareness. Health awareness refers to individual or community knowledge of having information or a certain understanding over the health issues. By educating the public on a specific health topic, an awareness campaign can play a role of promoting healthier behaviors that in turn improves the health conditions. Awareness, the prevention is a better cure rather than the treatment. In that process, providing knowledge to the individual as well as community on certain pressing health issues, that makes the situations very simpler and can be controlled in the early stage. The next part is the campaign. One is the purpose of health communication is to improve the health conditions and creating awareness. But the awareness, all the health promotion can be happen through certain kind of strategies, communication strategies. the health professionals and health department has to adapt certain level of campaigns involving specific promotional strategies to influence knowledge, behaviors, attitudes, or the government policies in targeting a particular segment of the society with a wide variety of multiple communication strategies to influence the audience. For example, to stop smoking campaign can achieve can reduce the negative impact of cigarette smoking by raising awareness of its risk and avoiding misconceptions about the smoking and promoting healthier behaviors. If the campaigns targeting the risk and the consequences of smoking, then there is a high chances of that the individual members, certain number of individual members may avoid smoking in order to maintain or improve their healthier behavior, healthier conditions. The success of a campaign often depends on a highly organized process that involves planning, implementation and evaluation. We have seen the awareness, we have seen the health promotion can be done through campaigns. Campaigns primarily uses electronic media and print media. That's the one part of the campaign. But in order to reach the wide nook and corner of the society, multiple players has to be involved in the health communication process. One is a communication system, mainstream media. Other one is the campaign has to involve the community oriented approach. The community centered prevention approach is designed to reduce the risk for common health conditions within a single community. The strategies for community oriented approach might include procurement of policy changes, programs and policies that address healthier behaviors, and development and implementation of wellness in healthy initiatives. In order to be successful of this community oriented approach, these efforts must be comprehensive, integrated and tailored to meet the needs of specific population. Another important component of public health communication is intervention. This is a multifaceted integration of strategies or programs designed to improve health status or influence positive behavioral changes. Interventions can be applied to an individual or within an entire group or population. An intervention may take a form of new policies, outreach efforts, promotional campaigns or awareness programs. Some examples of community based intervention include programs aimed at reducing high risk drinking among the certain age groups, as well as initiatives that seek to overcome barriers to immunization. India has a lot of strong historical records and proven health projects in the areas of immunization and vaccination. The many diseases being rooted out of our Indian context mainly due to mass campaign in the areas of immunization and vaccination. And any campaigns, we have seen the campaigns and intervention. The campaigns and intervention can be achieved provided if the people who are planning the campaigns and intervention understands and having adequate knowledge about their target audience. When it comes to the health communication, understanding the audience needs, wants, habits, lifestyles and motivations enables the health professionals to modify their materials, to modify the health content accordingly to the audience profile and utilize the appropriate channels that give the best chance of reaching them. Targeted health communication deliver the key messages more effectively and more likely to influence the behavioral change. There are the two more components in the public health communication. One is the risk communication and the social marketing. The risk communication refers to the exchange of health risk related information among various stakeholders, including the government, corporations, media, scientists, unions and public. Risk communication involves informing people about potential dangers of, for example, natural disaster or severe weather conditions or threat to the human health, such as disease outbreak like a COVID-19. The risk communication involves informing people about the potential dangers. Communications may be written, may be verbal, may be non-verbal or visual often include tips on reducing the risk. Ideally, risk communication involves two-way dialogue, and the mainstream media may not be able to play a very active role in reducing risk communication. Rather, the opinion leaders and community-based health workers potentially can play a very good role in conveying a risk communication to the targeted population. The social marketing is a term is very unique to the health communication part. The International Social Marketing Association defines social marketing as seeking to develop and integrate marketing concepts with other approaches to influence behaviors that benefit individuals and community for the better health outcome. These practices are based on the ethical principles and used best practices. One example of health care social marketing program is a campaign that promotes awareness about the benefits of breastfeeding among the mothers and the general public. And the marketing strategy has to employ multiple concepts of marketing techniques to reach the general public or targeted group like mothers, to convey the importance of the breastfeeding. There is a lot of success in this area is being achieved in multiple social settings. Now we have understood the multiple components of health communication, like awareness is crucial, awareness is meant for promoting health conditions. This can be achieved through campaigns and intervention. Campaign and intervention can be successful if both the strategies understands the target groups and characteristics of the audience, and we may not be able to employ all the communication tools for all the settings. For example, in the risk level, with risk communication pattern, the interactive method, interpersonal group communication more beneficial rather than the society-wide mass communication part. So these are the different components of health communication. Now we will understand how a health communication can be strategized in order to influence the behavior of individual or community in order to maintain the healthy conditions. The high impact health communication promotes behavioral changes on a society level. That's being the main components of health communication process. The health communication motivates entire communities into action, prompting them to live a healthy lifestyle by taking the necessary measures to prevent a disease and to protect and maintain their own health. The strategy of any public health communication has to be multi-pronged approach. It should include multiple approaches. For example, it requires a proper policy. It requires a proper health delivery system. It requires adequate health infrastructure. Communication system doesn't provide a treatment, doesn't provide a solution, and it can play a role along with the policies, along with the health infrastructure, along with the health delivery system. The health communication strategies needs to support the policy, needs to support its efficiency, it needs to support its main targeted outcome. In developing health communication initiatives, it is crucial to consider social cultural environment of the target population with respect to their cultural characteristics, language preferences and media habits. To achieve long-term goals of health for all, there is a recommended strategy for health communication. This is recommended by multiple literature. The literature recommends that 5 levels of health strategies works for better communication pattern, and that targets for changing the behavior. The one, behavior change communication, mainly employing interpersonal communication. Interpersonal communication is very effective face to face, and in the community health workers can influence their members. The primary functions of the behavior change communication is to change the individual behavior. The second component, second level of health communication is employing mass communication, preferably community media, mass media and even information communication technology. The third level is advocacy communication. It's a combination of interpersonal along with the mass communication, and that's a strategy of first round of campaign through all over India with the mass media approach. Further, the second level, the ground level community health workers take the same message to the individual level. So, already the audience are exposed to the mass media. So, community workers adds additional values to the adoption or change their behavior pattern. Fourth level health communication is participatory communication. Mainly here involves interpersonal communication and community media. The fifth level is communication for structural and sustainable social change. Here the interpersonal communication, participatory communication and mass communication are combined in order to achieve the health behavioral pattern communication. There are 5 levels: behavioral change, interpersonal level, mass communication to reach the mass level of audience with a limited time frame, and advocacy communication that combining interpersonal and mass communication. Participatory communication deals with interpersonal communication and community media. Now we will understand the different health communication strategic points or tools and factors involved in the strategies there. Any successful campaigns or strategy for health communication, the message carries needs to be accurate and it should be valid and without much errors. It should not give much scope for long process of interpretation and gives a different judgmental process. The message has to be very clear and it provides a proper clarity and leads to better understanding. Better the understanding, it's easy for the communication professional to influence a person to change their behavior. The second point is the availability. The materials or messages provided through campaign and intervention should be available at least little more longer time. If it is a television content or television public service announcement, it cannot be broadcast only one day. It has to be sustained over the period of time, or newspaper materials has to be repeated, or pamphlets, or it will be supported by community health workers. The material has to sustain for a longer period. Longer the period, better the chances of people, more number of people come into the system and getting the materials, and chances are there to change their behavior. The materials or messages in the campaign or strategies of health communication, wherever possible, the content presents the balance as a balance in the terms of providing the benefits and the risk of potential behavioral change. It recognizes the different and valid perspectives of the issue. It provides both aspect, positive and negative aspect of any particular health behavioral pattern. And consistency. The content remains internally consistent over the period of time and also consistent with other information from other sources. We are repeating many times that health communication cannot be achieved only through particular communication tools. It has to be holistic, it has to be multi-pronged, and multiple stakeholders has to be involved. Multiple stakeholders involved means there is a lot of scope for kind of miscommunication, or there is a disconnect between the multiple stakeholders. It has to be taken care and the content has to be consistent. That is very, very crucial, or else it will create a confusion. Confusion may not guarantee the behavioral change. And another important point is cultural competency. The design and implementation and evaluation process about health strategies or health communication should take consideration of special care about particular groups, their behavior, their racial or ethnic and linguistic diversity and characteristics, uniqueness, that needs to be taken care in while designing a communication intervention or communication campaigns. The success of any campaigns related to health factor all depends upon the cultural factors. Cultural factors plays a very crucial role in any health communication, particularly to change the behavioral pattern whenever there is a matter is very sensitive, or if the health matter is being considered as a taboo. And very crucially, we said that the material has to be accurate, and equally the content of the campaign or the intervention should be supported by a research background, research evidence, documentary evidence, relevant scientific evidence that has undergone comprehensive review and rigorous analysis to formulate particular guideline has to be supported in the content of campaigns and intervention. That adds authenticity, that adds credibility of achieving the health behavioral pattern. and the content gets to or available to the largest possible number of people in the target population. It's not particularly related to one urban or rural, and the material through the intervention, the campaign should reach the target audience, wider people, and the material has to be reliable and should be error free. The source of the content should be credible. So the content should be up to date. Repetition, the delivery of or access to the content is continued or repeated over the period of time, and that gives a better impact with a given audience and the reach of new generations. And now we have seen that multiple factors, for example, of culture and accuracy, credibility and repetition, availability and consistency, all these factors are meant for designing a better strategies. And we have mentioned that it should be backed with multiple communication tools in order to achieve a behavioral change, either through behavioral change communication or advocacy or participatory communication. Even though we have strong in understanding audience and using multiple communication tools, using multiple communication pattern, there are barriers to achieve public health communication. There are few factors that needs to be considered. There may be a level of low health literacy. Health literacy means the level of understanding of health issues, the consequences, and the people who are smoking, even though they may be able to understand the consequences, but they may not understand the severity of the part. Or secondly, the addiction part also matters the part. Not only the smoking, in other areas also, the understanding the health pattern, they take it lightly or very casual approach, or not able to understand the severity of the health issues. That complicates the matter, that plays a very important barriers while changing the behavioral pattern through communication campaign. And nowadays the multiple internet resources, information communication tools providing large quantum of information in related to the health information. We have separate presentation on media health literacy that we have taken extensive discussion on these two aspects, the role of ICT and the role of health literacy, while maintaining the better healthy conditions of individual and community members. There are two more important points for the barriers of public health communication. One is the proliferation of the availability of low quality healthcare information on the internet, and the informations are not accurate, not credible, might have influenced the audience to practice or accept that information for their own benefit. That complicate the original communication campaign and strategy undertaken by the health professionals of the particular locality. Another important point is inability of community health workers to communicate with the audience. The low level of health literacy and lack of credible information through online tools and availability of low quality health care and inability of healthcare workers to communicate to the wider audience of a particular community are considered to be some of the major barriers of achieving the behavioral change pattern through communication campaign and interventions. Thank you.